I actually don't care if you want to get an epidural or not, once you know what you're getting. Welcome everybody, I am Milenia, a midwife with a passion for education and empowerment through your pregnancy, birth and postpartum journey. Today we talk about a very hot topic, the epidural. Shall I get it? Shall I not? What is it? Can I have it? Can I not? All about it. A very quick premise to this video I want to make, that I really care about, that I want to make clear from the start. Once you make an informed decision, we, midwife or doctor, don't care about your decision. Once you know what you are deciding for your baby and your body, then it's fine. We don't judge women for getting epidurals. We don't care. Once it makes you happy. We want you to make your birth a happy memory. A memory that you can look back to and say, oh, I actually had a very cool experience. And we don't care how you get there. We are there to help you to get what you want. How do you make informed decision? Well, you're watching this video, so you're doing it right. You're actually gaining information and knowledge so that you can balance and evaluate what is best for you. What is an epidural in the first place? Well, we can definitely say that in 2020 it is the most effective pain relief for labor. It is a sterile procedure that consists in inserting a plastic tube into your spine in a place called the epidural spine, and through this tube, or also called catheter, a mix of medication is delivered through a continuous pump or through intermittent bolus, depending on where you are in Europe, in which hospital you are. Is it painful? Usually not. The doctor is gonna give you a numbing medication into the local area first, so you shouldn't really feel the needle go into your back, or you might just feel a bit of pressure, but generally speaking, it's not that much painful. It takes about 15-20 minutes to do it, and then other 15 to 30 minutes to take effect. So it's something to take in consideration when you ask for an epidural. No matter how quick is done, there are some certain time and steps that need to be taken in order to be a safe procedure and clean and sterile. It is done usually into different positions while you are sitting or curled on your pump with the shoulder nice and relaxed, chin to your chest. Sometimes some doctors they do it laying on the side. Is really a preference that they have, so it depends. What actually makes the procedure go smoothly and quicker is the position. So the better you sit and the better you prepare and the more you're able to stay still, the sooner and the quicker the anesthetist is gonna be able to place the epidural catheter. And remember, this is done in labor. So you're gonna have contraction, so you have to be able to stay still and in that position also during the contraction. But the midwife and the anesthetist are gonna help you to achieve and to explain you how to do that. Overall, with the progress and the advance that we made in developed countries, we can easily say that the epidural is a safe procedure now. So it goes pretty much straightforward. There are, of course, side effects and contraindications that I'm gonna briefly tell you, but overall it is a safe enough procedure to get in childbirth. Minor side effects may include being nauseated after the procedure, being very itchy, that's actually quite common, having some heartburn, and then going towards more serious contraindications such as a dramatic lowering of your blood pressure, nerve injury, spine damage, but those are very rare complications that are there, and the nurse is gonna consent you and is gonna inform you that, but the more you know before, the better to prepare you. Something to say that I feel that a lot of women getting an epidural don't know is that after you have an epidural, then you need to go on continuous fetal monitoring, meaning that if you were having a low-risk pregnancy, a low-risk labor with intermittent auscultation, well, after the epidural, we actually need to monitor baby a bit more closely. Why is that? Because a strong medication is delivered into the spine, it goes into your blood flow, it goes into the placenta, therefore it goes into baby. So we need to know how baby is reacting to the medication. We also need to monitor you a bit closely, mama, meaning that we need to check your blood pressure frequently, your temperature, your saturation, and your pulse rate. Another thing that it is usually done after an epidural is the insertion of a urinary catheter, meaning a tube that goes into your bladder in order to drain the bladder and keep it empty during the labor. Why is that? Because you are not going to be able to stand while you have an epidural, or even if you are, you might not feel the sensation of your bladder getting full. And we don't want a full bladder in labor because it's going to keep the baby's head high, and we don't want the head to be high. We want your baby's head to be nice and engaged in your pelvis, ready to come out. Some places they do provide something called a walking epidural, meaning that you're actually able to walk and to mobilize although you have an epidural placed. Obviously, the medication that it is delivered, it is in a different dosages, so the feeling it is actually more, meaning you feel more. If an epidural is something that you want, you might want to check with the place you're giving birth what they do and what pain relief options they have. Generally speaking, an epidural leads to more intervention in terms of monitoring, yes, of checking you, more internal examinations. Sometimes the contractions slow down after an epidural, so sometimes we need to augment the contraction via intravenous oxytocin. Also, the main downfall of an epidural is that you're not going to be able to move too much. We can definitely move in the bed. The midwife is going to help you that by using peanut balls and make sure that the baby is able to rotate anyway. That's absolutely important to do, but you can understand that being on the bed has a limited position that we can assume. So that leads to higher incidence of malposition of the baby, meaning that the baby doesn't rotate properly in the pelvis, and then therefore it increases the chances of having an instrumental delivery, meaning by ventus or forceps. Generally speaking, labors with an epidural, they tend to last longer. I'm gonna put you anyway links in the description where you can see the studies and make your own conclusion. That being said, epidurals are a great tool, and in some situations they definitely help you women to relax. And sometimes because you were actually fighting with your own hormones and your own body and your own oxytocin, by producing adrenaline, by having an epidural inserted, you might be able to relax, to rest a little bit, and actually to dilate quite quickly. It is something that happens sometimes. It is also very good when you have an epidural placed in the case that you go for an emergency cesarean section, because the epidural catheter is already there, so it just needs to be topped up by the anesthetist, and then you're gonna go completely numb, so that if it's a procedure done in a very emergency situation, then it is actually quicker to have an epidural already in place. And also, if you require sutures and stitches after the birth, then again you're not gonna feel that pain too much because you're already anesthetized and numbed. Another great benefit is that it is a great pain relief option, meaning that you're not gonna feel the contractions much. When can you have an epidural? Technically at any point in labor, meaning when you are at least 4 centimeters dilated with good established contractions, and you don't have any particular infection going on, you don't have any infection in the area of the epidural, and there is no particular contraindication due to your case. So if you have had an injury into your spine, a car accident, or scoliosis, or particular situation, then you want to have an anesthesiologist review before labor, so that the anesthetist can see your situation, they can assess if you are eligible to have an epidural. When can you not have it? Well, if you are too early in labor, because we don't want the epidural to slow down everything, and then you've been stuck even before you're actually in established labor. If you are too late with your labor, meaning that if you come into the hospital that you are bearing down, nearly ready to push, and you're begging for an epidural, well, I'm sorry, you're not gonna be able to sit steady for 15-20 minutes while there is actual baby coming out of you. And even if you do, by the time the epidural takes effect, the baby's gonna be out. So if the midwife or the doctor suggests you not to because it's too late, I will trust the staff. But again, it is done with your consent, and it is your own decision. That being said, whether if you're planning to labor with an epidural or not, I really want you to know everything that it is involved and what might happen while deciding to have an epidural. And even if you're 100% sure that you're gonna get an epidural, that that's what you want, that's your birth plan, that's fine, but you need to have a plan B. And why is that? Because there are situations where you cannot have an epidural, as I said, if it is too late, if it is too early, or if the anesthetist is not available, if there are emergencies going on, one or more cesarean sections going on, and they cannot come down to do an epidural to you, or if you have to wait because another woman is getting one, or there is actually a queue of women that need to get one. You need to be able to have strategies to cope while you wait for one, because otherwise you're going to lose it and you're going to freak out, and we don't want you to do that, because then it interferes so much with the labor progress. So please do get information and education, even if you're planning to get an epidural. Prepare your partner. Learn strategies that are gonna be able to calm you down and to reassure you and to be able to cope for the time while you wait an epidural. Also, even if you get an epidural, it might not work as well as you expected. There are some epidurals that are weaker than a woman expects, and there's nothing that you can do. The nurses can top it up to a certain point, but then we can't exceed the limits of the drug that it is delivered to you. It can be one-sided, meaning that you actually feel more on one side than on another. It can also be patchy or spotty, meaning that there is some part of your abdomen where you actually feel the pain. Sometimes it can even work too well, meaning that you don't feel anything and you cannot even lift your legs because it's very heavy, it goes too much higher, it needs to be stopped, it needs to be checked. You're not able to feel the pressure during the contractions, and you're not be able to direct the baby when it's time to push. So there is a lot that can go wrong, so that you need to be able to cope with every possible situation, and the only way you have to cope with the situation is if you actually know these situations. Even if an epidural has been placing perfectly and is working absolutely well, you are gonna feel pressure. And when I say pressure, I don't mean something pressuring here. You're actually gonna feel like a ball is coming out your back passage. You're gonna feel it constantly, and then you're gonna feel it more intense when you have the contraction. And there is no epidural in the world at the moment that is able to let you take away that pressure. Even you might not feel it for a while, but then when it comes, when you're 10 centimeters dilated and the baby's down in your birth canal, then you're gonna feel the pressure. However, I do think that is something that women don't know, or it is an information, a detail that we don't stress enough about. You're definitely gonna feel pressure regardless of how good that epidural is. That's all for the epidural ward. I'm gonna wrap it up here. Best of luck. Let me know if you have any questions and if there is something that I haven't covered in this video.